webinars that complement this one, and one of those is called Alleviating Everyday Aches and Pains. And so all of these talks get housed either here now that we're using Microsoft Teams, here where you can go back and watch, but also we have the old recordings. So the previous classes are actually recorded and listed on our wellness page under archived webinars, and those are YouTube videos. So feel free to share those out. I would love for you to, because as a child, I always wanted to be Dear Abby. So when y'all ask me questions and I get to answer them for you, I'm really living out my childhood dream. And, as an adult, I thought, how fun to be a YouTube star. So I am not a star, but I am on YouTube. So feel free to share these videos. Y'all can watch all of them or any of them. So getting active after not being active for a while. Yes, Catherine, we can talk about that. 35 years old and want to know about some good food habits and morning routines. Good, good, good. Okay, well, I'm going to take y'all back off my screen and go back to the presentation. But we'll definitely get to those things and more. So some common health concerns after the age of 40, we're talking about this emphasis of 40 and above, but 40 is not a magic number. 40 is what we used to think of as midlife, and it is in a way, but it depends on a lot of different demographics and things. And so 40 is not a magic number, just like January 1st is not a magic number. The thing is wherever you are in your stage of life and wellness, today is the best day to start. When I was first thinking about making changes to my health and to my wellness, I always was like, oh, I'm going to start on Sunday or I'm going to start on Monday because I wanted this nice, clean, like starting point. And I will tell you, starting right now, starting today is always the best time to start something. And I have a talk on creating good habits that last that goes more into detail of that. So that's another one I'll recommend for you. These are some of the things that you can experience as you start to age, but honestly, these are just kind of the big ones. So things like chronic pain, it might be from arthritis or back pain or tendonitis. Chronic pain usually is either generalized, like kind of a fibromyalgia type pain, or it's back pain. Back pain is like the number one pain that we see that's recorded in the US. And so back pain is very hard to diagnose and it's very hard to kind of figure out a reason for it because your back does so much work. So that's a really, really common one. Things like tendonitis, muscle pain, and then like I mentioned, generalized pain is going to be right there, kind of neck and neck with back pain. Joint health is always usually a concern, especially usually women. That's on our radars to be a little bit more cognizant of that. Osteoporosis, and we always think about drinking more milk, but there's a lot of, kind of myths around drinking more milk for your bone health. There are things that we can do that will actually support it better with things like vitamin C and vitamin D. So drinking milk is not the solution, according to Abby. Do your own research and do what feels comfortable for you. Talk with your own primary care provider, your doctor, your nurse practitioner, your physician's associate. But for me, drinking more milk is not the answer for that. Stress, that's so important to manage. That's something that I struggle with because I take a lot on my plate and I love to live that way, but that can cause stress sometimes. That's just kind of how I'm naturally wired. So it's really important for you to develop self-awareness. We all have our own unique journeys and struggles and challenges. Stress can be acute and chronic. Usually it's both. You could have mental health challenges with depression and anxiety and so many other things. Heart health definitely is a concern. It's one of the number one, concerns for people in the U.S. overall. And then kind of within that umbrella of cardiovascular health and metabolic health, you've got blood pressure, cholesterol, triglycerides, changes in your resting heart rate. Inflammation is a big one too. Most people today are inflamed because we have the SAD or the MAD diet in the US, the standard American diet or the modern American diet. And so, that is something we have to really think about shopping the perimeters of the grocery store. So maybe that balanced basket class would be a good one for y'all. Communicable diseases, we used to die from things like, flu and pneumonia and things that we didn't have vaccines for or immunizations for. And now we really die from these chronic health diseases. So only in like the last, really probably 50 to 60 years have we started dying from these long-term chronic conditions because before we died from things like accidents, injuries, and then these communicable diseases that we didn't have, vaccinations to help us overcome. So really, we are seeing, a lot of issues in healthcare today, but it's because, we've been doing healthcare, nursing, doctoring for a really long time, but we weren't dying from these chronic health conditions. And so we're hearing a lot more about preventative health practices that we're trying to implement here through Wellbama as well. Blood sugar is always a big one. I think blood sugar and inflammation, if you can get a handle on your blood sugar, your inflammation, and your stress, I think those are the three big ones that we could all focus on, and we would see so much improvement in just our overall well being. Body mass index, I don't talk a lot about that because it is not the end all be all. There are a lot of issues with those metrics, but you're going to hear people and you're going to see in textbooks still say that that is a really, really great metric. I don't think so for a lot of reasons we don't have time to go into today. I think it is a standard. I think it is a benchmark to see where to see where you stand, but it is not. It's not really an inclusive metric, and it's not a metric that has been updated in many years. And so lots of issues there, but I think it is a good one. I do check my BMI. I think it's a good kind of touch point of where am I on my health journey, but I don't let it make me feel bad if I don't like the number anymore. That, how your clothes fit, what the scale says, how you feel, what your lab numbers are showing, what your nutrition is like, those are all kind of better metrics. Skin cancer is definitely on the rise. Breast cancer is on the rise, especially for young women. You've got changes in hearing and visual acuity that can happen. And all of these things are pretty common, but just because they're common doesn't mean it's normal. And we'll talk more about that. Hormonal changes, sexual health changes. So, not just that your hormones are changing, but also your sexual health, your sexual relationships, your sexual needs change. And I don't think we talk about that nearly enough. It's a little taboo, I think, in our culture to talk about that. Lifestyle changes. You might be in the sandwich generation where you're raising young kids and also caregiving for, friends, family, neighbors, aging parents. And so that can be a challenge. And then just overall mental health. We think about depression and anxiety when we talk about mental health and even stress, but we have many more things that kind of relate to a mental and emotional health wellness. And so those are the things that you could think about when you think about middle age. You also think about this kind of midlife crisis. And so Brene Brown, if you know me well, you know that I love Brene Brown. We would be best friends if she knew who I am, who I am, but she does not. But she talks about midlife as not really a crisis. She says it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open everything back up to heal the hurt. So she says that midlife is not a crisis, but midlife is an unraveling. And so I think midlife is this time where you really can pause and reflect and reset. I will tell you, I am closer to 40 than not. I will be 38 in February. And so as I'm approaching 40 and as I'm seeing my oldest, daughter start UA early college and, she's about to turn 16. And, these are the kind of milestones, 40, 16, seeing your kids grow up. Those are the kinds of things that give you kind of pause, right? And I think our emotional health and our mental health, our spiritual health plays so much more of a role in our overall health, our physical body, than we give it credit for. And so sometimes when our bodies and our brains, aren't really talking to one another, very well, and when we're not pausing to reflect and to reset and to rest, I need to add rest to this slide. When we're not doing those things, then our body will start to give us signs that there's a problem because our body is designed to take care of us. It's designed to give us what it needs to survive, right? That's its goal is to survive. Our brains are not designed to make us happy. Our brains are designed to keep us safe. And so when we're not listening to those things, when we're not pausing, when we're not silent enough to hear those, when we're not reflecting, resetting, resting, then what happens is we get these symptoms in our bodies and we have to kind of we have to kind of take note of those, right? We have to listen to those and attend to those needs. So sometimes, if we're not doing the things we know we need to be doing for our mental, physical, spiritual, emotional health, and we're not resting and we're not eating well and we're not sleeping well, then we're going to have aches and pains. We might have an accident or injury. We might have a body system, an organ that isn't happy. And, obviously, there are lots of reasons why something can kind of malfunction in the body. But really, instead of seeing it as a malfunction, it's really designed to alert us, right? It's our dashboard lighting up, telling us we need to take a look at what's going on in our lives. And so I hope that that's helpful to you. Some people really are concerned about approaching midlife. I have to say, it's not my favorite milestone. For a lot of reasons, but for me, I'm learning to really embrace that, and I hope that that gives you the encouragement maybe to think about midlife a little differently. So, screening and prevention is really the key to healthy living. And I believe that more than anything. We are so fortunate to have Wellbama and to have the Wellness Work Life team and programming for us here at the university. I know that I don't think about how much we are offered as employees at UA in terms of benefits and just, really a lot of support on campus. And so, it takes a moment of having gratitude for all the things that we can take advantage of, and we want you to take advantage of these programmings. So we have the Wellbama health screenings where you can get checks on your cholesterol, your blood sugar. We look at your triglycerides. We calculate your BMI. We get the measurements for your height and weight, and then you meet with a health coach, which is usually a fifth semester, so a senior nursing student who's about to graduate goes over those numbers with you and does health coaching that's really personalized to you. You set health goals and self care options. And, I think it's a great way to, take a field trip while you're having your work day. You get to go to another building on campus. You get to meet some new people. You get to get an apple and some free swag. And, you get your $50 for completing your screening. And then you also get some really good health numbers that can tell you where you are. So in health and life coaching, we always say know your numbers, and that means, your lab numbers, your other metrics, so that you can kind of gauge if you're doing something to improve your health, is it working? And is it working in a way that we can see it tangibly? Sometimes it's working and we just haven't given enough time to show up on the paperwork, right? Um, but it's always worth doing, even if you're not seeing the improvement that you're desiring. And so sometimes it just takes a little bit for your body to catch up. But also then, you're getting your $50 for completion. And so that's a nice gift card that you can use to do something for yourself, something nice. So think about doing your wellbeing screening if you haven't. It's done once per year. And so you can do that. And then if you also schedule like a class like this counts for it and a program that Miranda mentioned, you get another $50. So up to $100 plus all of this like free swag and information that you're getting to do during your workday. So I hope you enjoyed my promo for Wellbema. I'm really excited because selfishly, I will get to see you if you come by because this year I'm getting to do health screenings. I normally only do those during the summer with students, but now you'll see me at the health screening. So come by and say hello if you do sign up. We would love to get to see you face to face. So, some annual physical exam recommendations. We want you to see your healthcare provider. That might be a medical doctor, it might be a nurse practitioner. We don't really use a lot of physician's associates in this way in Alabama, but other places will actually have physician's associates, or you might know them as PAs. They were formerly called physician's assistants, but that name didn't really represent their scope of practice. You see PAs here more in Alabama as like um, a liaison and a medical professional that surgeons utilize. And so, anyway, just wanted you to know we're going to say your healthcare provider, or we say your PCP, your primary care provider. We love to have, different words and medical terms and abbreviations in healthcare. So see the person that you typically see to keep an eye on your health. It's really good to schedule these and not just go when you're sick because you need to have baseline numbers for when you're healthy, so that when you are sick, if there's a change, then that person can really note that. So you also want to be able to have a good relationship and rapport with the person that you're seeing so that they see you on a good day and not a day where you're really sick and you need help. So definitely set those up. Mark that on your calendar to do when you get off this call today if you haven't done that for 2023. Or if you have and you haven't set up your one for 2024, go ahead and get that on your to-do list. But a routine physical exam helps screen for medical issues. It helps look at your risk for future medical issues based on your health history and your family history. It helps encourage a healthy lifestyle. There's nothing like having to step on a scale with another human that makes you feel a little bit accountable for that. And again, the scale is not the end all be all. It doesn't tell the whole picture of health. And so please hear me on that one. You can get up to date on your immunizations, and it really does help build that relationship with your healthcare team. And if you don't look forward, let me say it this way, if you don't look forward to going and seeing your primary care provider, then find someone else because they should be someone that you look forward to seeing, that you have a good relationship with, that you have easy access to. And if that's not the case, then go and shop for someone else that fits your personality and your needs better. Um, I am always really loyal to the people that I go to see for my health, but there are different times, different seasons of life where you just might need another connection. And it's good to have a good team that, is consistent, that knows you best, but sometimes you do have to look outside of the people you've always seen to get a little bit more help and support. So don't be afraid to do that, right? Anyone that you're seeing that you're paying for a service, anyone from someone cutting your hair to someone cleaning your teeth, you want to make sure that you look forward to seeing them. And if you don't, then kind of evaluate, is it time to make a change? Annual physical exam with lab work is really important. Make sure you're getting your dental cleaning and your exam twice a year. And so that's really good. With our insurance with Blue Cross Blue Shield at UA, you can go up to 2 times a year just for your routine exam and cleaning. And that is recommended. So try not to go every year, try to go twice a year because that can really help in preventing tooth decay and other issues that are going to be more costly and time consuming and not good for your health. Your dental health is foundational to the rest of your health, especially your heart health and your immune system, because there's so much plaque and buildup and germs that can get into your mouth that when those things are cleaned or get dislodged kind of naturally with your eating and drinking, that can impact your overall health. And I don't think we talk about that nearly enough. Hearing screens, we usually don't do those once you get past elementary school unless you have an issue. But if you are working around loud noises, if you have a history of early hearing loss, if you are having trouble tracking conversations, things like that, then go and get a hearing screen. And let me say this, hearing is really something that's complex. My little boy, well, he's not so little anymore, he's 13, but my son Graham has sensory neural hearing loss. And so I learned so much about hearing just based on our experience with him having hearing aids since he was a baby. And I noticed that I was having some issues with my hearing, but when I would test with an audiologist, my hearing was pretty good. I just had a little bit of a loss in one ear. And so it didn't account for some of the conversational problems I was having. So his speech therapist actually recommended me to see a specialized audiologist. And I had a new test done, and it was talking about auditory processing disorder. And that's something that I am struggling with as an adult because it's all about how the sounds get interpreted and then sent to the brain because the brain and the ear are really talking to each other. And so just because you get one value and you get one assessment and feedback on that doesn't mean that that's, the end all be all, right? So definitely think about if you know that you're having issues, there may be other things going on. So hearing looks good on paper, but then I have this kind of underlying, kind of auditory processing disorder. And if it hadn't been for my son, they probably wouldn't have looked deeper than that. So never, never, never accept what someone tells you as the gold standard if you know that you're having issues. So I like to storytell because I think we can learn so much from each other in that way. A comprehensive eye exam, you definitely want to have that with pupil dilation once you get to the point that you're 40 and above. I think there are a lot of reasons to do that, anyway. So for me, you can go to an optometrist and just do the reading exam check and check your vision in that way. I am always a fan of going in every year to 2 years, depending on your risk factors and what your ophthalmologist tells you of going and having that annual exam with pupil dilation because that's going to look at the veins and vessels and arteries and things in your eye to check for glaucoma, to check for good health of your eye, and then also to look to see about your visual acuity of do you need reading glasses or Are you nearsighted or farsighted? And so I think an optometrist is great to get those reading glasses, but I'm always a fan of doing an ophthalmology exam because you're going to get that eye health component that you're not going to if you just go to like an eyeglasses, um, you know, place of business. Blood pressure screenings are really important. We have two locations, one on our alternate campus over where HR is now located. There's one in that building, and then there's also one in the student center near the Starbucks. And so it's right around the corner from Starbucks in the stairwell, and you can go there to get your blood pressure checked. There's little kiosks there, but you can also use them in like your grocery store or in your pharmacy. I think it's important to kind of take a breath, don't run into the store or run into the student center and then take your blood pressure because your blood pressure needs to settle out a little bit. But that can be a good place to do a reading check. I think that it's something that you could even consider having in your home. They're pretty economical, like less than $50. You can get a digital blood pressure cuff. And I keep that on hand because I think it's important to be able to check that. Our blood pressure checks, and fluctuates throughout the day. So just getting a one-time reading once a year, it can take a really long time for you to get diagnosed with hypertension because you're only getting it checked once a year. And then a lot of times people know about white coat syndrome. And so sometimes we're saying that it's white coat syndrome when really you do have a hypertension issue. For me, I just like to explain, and we have a talk on cardiovascular health if this interests you. It's one of my favorite topics. But it actually talks about the difference between hypertension and high blood pressure. Any of us, all of us, can have high blood pressure. If we were to go drive home in 5 o'clock traffic this afternoon, we probably all have elevated, higher blood pressure. But having 3 or more readings that consistently stay high can then kind of end up in being a hypertension diagnosis. And so we say high blood pressure and hypertension are the same, but they're really not. Hypertension is the medical diagnosis of having consistently high blood pressure. Cholesterol screens are really important. Y'all, again, this is something that you have to look at all of your numbers. You can't just look at your total cholesterol because we want your total cholesterol to be less than 200. I go into this more in the cardiovascular class. But you also want to know what your HDL, your LDL, your triglycerides are because you could have an elevated over 200 cholesterol screen, but your HDL, which is what we call your healthy cholesterol, it's all needed. So LDL is not bad, but what's considered your more healthy HDL could be high, and that could be putting your number over. So overall, your numbers could look really good, but if you just get the total cholesterol and you're not getting the other numbers, then you could mistakenly think that your cholesterol numbers are really kind of terrifying, and they're not. So it's always good when they say, oh, your total cholesterol is over 200 and say, oh, okay, great. Could you tell me what my HDL, my LDL, and my triglycerides are? That's going to be helpful. Diabetes screenings are always really, really important. That's screened in a lot of different ways. You can do just your regular glucose check, but also you can do your HbA1c, which looks more at 90 days, which is going to be more accurate because any of us could run and go get a treat and our blood sugar be a little bit elevated. So it's more about how your baseline blood sugar is in the morning and then what it does in terms of how much it spikes or drops after you eat and drink. Especially sugary things. Once you get to about 40, depending on your primary care doctor, you could be getting a baseline EKG and chest x-ray. So know that those are things that people might recommend. And then also a check on your thyroid. So they actually, when you touch your thyroid and you put your hands there, there's a special technique that clinicians will use, nurses, nurse practitioners. We're all qualified to do those, but you check from behind the person and you have them swallow. You check one side and then the other to see if you notice any nodules, masses, tenderness, any enlargement of the thyroid. Your thyroid is that butterfly-shaped gland around your neck. And it's kind of the engine of our bodies, but we don't really think about it that way. And so our thyroids are really, most of the time in the US, we're going to see more hypothyroidism, meaning that your thyroid's just not working quite enough to give you good energy. And that's definitely something that people have. We use the word complaints in nursing. I know that sounds a little negative, but we see more complaints around lack of energy at 40. And sometimes that's not just a thyroid issue. Sometimes it's just life and stress and work and all the things. But a sluggish thyroid is definitely going to make that feel more difficult. Immunizations, y'all, we've got the flu, you've got tetanus boosters that you might need, the pneumococcal vaccine for pneumonia, you've got hepatitis, of course, you've got the new COVID vaccine. Those are all things that you could consider. You also have colorectal cancer screening that should begin around age 50 unless you're at high risk. Some people are even saying age 45 because we've seen an increase in cancer for both men and women. It's recommended that you get a colonoscopy every 10 years or as directed by your primary. And then you could even do things like these fecal occult blood tests or the immunochemical test. And so those will all be things that are recommended to you based on your individual risk factors. And that's why it's so important to have a primary doctor. We also need to think about things like mammograms and thermography. From the medical side of things, mammography is always going to be the kind of the gold standard, the thing that is best and most recommended. There is a lot of controversy over using a thermal scan on the breast, which looks at the heat patterns of the breast. But a lot of women who are younger and a lot of women who have dense breast tissue, mammograms are it's difficult to see through dense breast tissue a lot of times, and that's why they usually don't recommend you going until after age 50 when your breasts start to lose some of that density because you can miss things. So younger women might get thermography or they might get ultrasounds if you think that there's an issue with the breast. I'm telling you a lot of personal things today, but I hope it helps you. Y'all let me know in the chat if it's helpful to hear these stories. But several years ago, goodness, I was in my early 30s. I found a lump in my left breast, and so I couldn't tell if it was a lymph node or if it was truly a lump. And so I went and I was referred to a breast care specialist at the local hospital, and I met with him and ended up having an ultrasound because I had two enlarged lymph nodes and a lump in my breast. And so, because of the issues of scar tissue and the way that breast can interact, especially with young women and the dense breast tissue, I was not recommended for a mammogram, and they didn't recommend doing a biopsy because there's something called seeding, where if there is an issue and you do a biopsy early on, it actually can make the problem worse. And so for me, my care provider, gave me very specific recommendations, and then I made a choice, right? So it's always good to be informed and ask questions. And so that was something that I had to monitor for 3 years. And my mom also had the same experience, very similar to me, when she was in her 30s. And so family history does matter. We say a lot of times, like, oh, 85 to 90% of the risk factors and things that you do is all lifestyle now. That's our fun thing to say. When I was in nursing school, everything was about your genetics. Genetics calls everything. And then we've had this shift. Everything is caused by lifestyle. And in my personal opinion, it's both. It's yes, it's lifestyle and it's your genetics, and it's both working together, and it's the environment that you put your body in. I don't think it's an either or. And so it's good to kind of be aware of those things. Because women are now having more and more breast cancer episodes less than age 40. I mean, we're seeing women in their 20s and 30s having very advanced breast cancer. They have actually recommended that the guidelines be maybe age 40 to 45 of starting to do mammograms. So you're probably not going to see that recommended right now, but that is a conversation that's being had through the American Cancer Society. And if you have risk factors, meaning that you've had a mass, a lump, something like that, enlarged nodes, you've had a family member that's close relative, a sister, a mother, a grandmother, an aunt, then they probably will have you be in a higher risk category, and they probably will recommend more often having screenings done and then earlier. So, regular average risk factor, if you're a woman 50 to 74, then the recommendation is a mammogram every 2 years. And of course, they can change that based on, what's going on there. I did not list, I don't think on this slide, and I will add this, is looking at your cervical exam, having a pap smear. It may be on a different slide, but I'll probably add it here as well. Pap smears, we used to have those every year with our gynecological visit. And I think that's an important one to schedule if you haven't done so. That is one that a lot of women do not schedule, and it's not one that's very pleasant. But now, if you've had a free and clear, like you've had no issues, no signs of abnormal cell development, sometimes you can go out to as far as 3 years for your pap smear, and looking at, like some of the human papillomavirus and things like that that are kind of coming up. And then there are some providers that once you've had a hysterectomy, depending on the type of hysterectomy you've had and your age, at some point then your care provider will say that you no longer at a high risk and you don't have to have some of those tests done. So just know that that is also a possibility. So ask your provider about your risk factors and your age and all of that. Prostate exam for men, so age 50 for men who are at average risk, age 45 for men who are at high risk, and then age 40 if you have an even higher risk, meaning that you have a first degree relative, or you've had some issues with your prostate to start actually having those annual exams. And then, of course, we recommend that you stop using any sort of substance. This could be an illicit substance. Obviously, we don't recommend that, but it could be things that are perfectly legal and perfectly socialized things that you can do, like nicotine and vaping and tobacco products and, you know, anything from cigarettes to like the little incense that you can get. Fragrance is something that I highly recommend. If you have a plug-in in your, in your outlet, if you have those Pura plugins, the Glade, the tree hanging from your car, any of those extra sources of fragrance. If it says fragrance, there are a ton of chemicals in those. And they're not all tested through the FDA, and there are a ton of people who have sensitivity to those. Those are all going to be things that are just as harmful to you if it says fragrance as things like nicotine and smoking. So, like if you wouldn't pick up a cigarette, then I wouldn't recommend having a plug-in or a fragrance of any kind. I'm really passionate about that one. If you know me in real life, that's something that I think we really have to look at. They say, kind of at the national level, that sitting for long periods of time and using fragrances are the new smoking today, because it's so prevalent and it's so acceptable, and it's so easy to do, right? And so definitely think about those things. Make fiber your friend. Using, fibrous breakfast, items in the morning is really helpful to get, some of that. Someone mentioned bloating, water and having fiber. Although fiber can initially help with the bloating, it also can make it worse. So just finding out fiber that you can incorporate into your diet is really, really helpful. That will help with the prostate. That will help with the gut health too. So with constipation and things like that. And then you want to work toward building good muscle and bone, because muscle and bone really work well together, and you want to have strong bones because that is one of the keystones of longevity, which is a big topic right now. If you want to live longer, you have to study longevity. Longevity tells us that we've got to be able, to get off the floor. We've got to be able to be moving and mobile, and we've got to have flexibility. We've got to have good bone and muscle and joint strength. And so these are some of the things that will really help with that. Additional screenings, I've got the pap smear here. So your annual clinical breast exam, so having a provider do your annual breast exam, but then you also doing your monthly self breast exam. So picking a date if you still have a menstrual cycle after your menstrual cycle so that you're not tender, and your hormones are in a different place at that point in the month. It's better to do them after your cycle usually. And so just pick a month. If you're not having a cycle, and particularly if you don't have your ovaries, then you can just pick a random date. And if I have to pick a random date, I usually pick my birth date day. So I was born on the 12th, and so I picked the 12th as my date because that's an easy one for me to remember. So if I need to do a self breast exam, then I'm going to pick October 12th or November 12th. So I think that's one that can really be helpful. I try to put things on Wednesday just because I like alliteration. So I'm like, it's Wellness Wednesday. This is what we're doing today. So that helps me, but do what works for your schedule. Having a pelvic exam is really important. More and more women are having issues with pelvic floor instability, to the point that my OBGYN actually is talking about having a pelvic floor specialist, which is usually a physical therapist, actually in-house, in office, because so many women who've had children, and women just in general, have a lot of pelvic floor instability. So that's something to really think about. A pap smear is usually done with the pelvic floor exam in your gynecological visit, and you may not even know that that's happening. Um, Usually that's when they're pressing down on your stomach while they're also assessing, kind of the interior structures, and they're doing the exam. And then you can have a bone density test. Probably that's not going to be something that's routinely recommended, but you can definitely ask about that. And then for men, everything is done in male versus female. I recognize that it's a lot more complicated than men and women, but this is how the data is reported. So for those who have testosterone on board and who need to do an annual testicular exam, that's important to have that done. Usually a urologist does that along with prostate screening, and then you can do a monthly self-testicular exam. For men, their hormones really go on a 24-hour cycle versus women who usually have a monthly cycle, and so it doesn't really matter for when men do the self-testicular exam as long as they feel for any lumps, masses, bumps, tenderness, edema is really important there. Same thing with the self breast exam. You can do a quick Google search, and there are some patterns of how you move your fingers. The biggest thing is that when you're doing both exams, is that you don't move your fingers off of the tissue. So when you're doing your self breast exam, when you're doing your self testicular exam, that you move your fingers on the skin. You don't lift up and move to the other area. And there's some patterns that will show you how to do both of those exams with just a quick Google search. So I also included this from the last time we did the class is 10 healthy habits by 40, and I included the link here, but I think these are so good. It talks about having preventative health care, which we've been talking about, having a positive attitude, sleeping well, exercising, being more mindful about our nutrition, drinking more fluids, getting our finances in order. Y'all, in the US, and y'all fact check me on this, but the last time I looked, the number one reason for people who were getting divorced were financial issues. And the number one reason for having financial issues was because of um, issues with not being able to afford their healthcare services and having like basically medical bankruptcy. So when you look at this, people have said, do we have a divorce issue in this country? Do we have a financial issue in this country? Or is it that we really have a healthcare crisis issue? Because we're really seeing that the finances are kind of predicated on the health, and the health and all of that is driving the issues with finances and divorce. And so that has a trickle down effect. And so we really have to kind of go upstream to see where we're having the problems. And so taking care of your health is your greatest wealth. People ask me all the time in health and life coaching, and I ask myself the same question. If you're struggling with your health and your finances, where do you start first? You start with your health first. And my barrier to that was always, well, I don't have the extra money. And this was, 10 years ago. My kids are little. I don't have the extra time or money to invest in my health. Like I need to work on something else. And the thing is that that's exactly when you need to work on your health first, because everything flows from that. If your health is not where it needs to be, you're not going to have the time, the money, or the energy to do anything else. And most of the things that you need to do to improve your health are free, but we live in a $1 billion with a B industry that tells us that health and beauty and fitness has to be expensive and you have to pay for it. And you don't. Drinking water is free. Would it be better if it's filtered? Yes. It would be more healthy, especially in our water system today. But is water better than Coke that I love dearly? Yes, it is. And so, unpurified, unfiltered water is always going to be better than Coke. Um, does it taste better from a Stanley cup? No, it does not. It doesn't taste better. It's a little more convenient sometimes because you don't have to refill it as much, but it doesn't taste any better. So let things be free and fun and as cheap as possible, because those are the things that are going to be sustainable. And I can tell you that through my journey, I was overweight for most of my life. I was in category 2 obesity for 10 years, most of my adult life, after having had babies and multiple twin pregnancies. I had two sets of twins. So I can tell you that I didn't have a big budget, and I had to figure things out on my own. And that none of the things that are sold to you as helping with weight loss and health and all of that, yes, those things are nice and they're extras, but they're not essential. You can do everything that you need to do on a shoestring budget. So don't let that kind of be sold to you like it was to me for so long. Get your finances in order, maintain the healthy sex life. Again, I think that that's so important. Some people think that having a healthy sex life is a bonus, and I don't. I think that it's really something that is kind of wired in our human nature. And so I think that that's healthy, and that's what's healthy for you. That's not some prescription, of how often you should be having sex or, what you should be doing in terms of, fulfilling those needs, but having that conversation with your partner. Confronting the things, and they use the word vices. I don't like the word vices, but confronting the things that aren't helping build health, I think is really important. Something that is healthy for you may not be healthy for me. And I use this example with my nursing students all the time, is that someone who has, GI issues and who maybe has diverticulitis, they have inflammation and swelling in their stomach. Broccoli is healthy for me and I love to eat it, but that person can't eat broccoli. That's not healthy for them. So we've kind of got to get away from this messaging of this is good, this is bad, this is moralizing something that is this is healthy, this is not healthy, because the thing is that broccoli is healthy for me, but broccoli may not be healthy for my friend or for my patient, right? It might actually be something that makes them very sick. So I think we have to kind of get away from that. And then meditation, I say that meditation, movement, mindfulness, all of those kinds of things really help our bodies get rid of the stress response that we have at a physiological level. Our bodies are designed to move to get out of stress, because we have that fight or flight. We have still that prehistoric nervous system that wants to fight the tiger or flee and run away from the tiger. And that doesn't always work well with emails. And so if you start feeling stressed, getting up and moving your body is really, really helpful. Meditation helps with the pausing, the reflecting, the figuring out where you are and what you need to be doing. So the article is here for you. Some hormonal changes that you might see in pre and peri and postmenopause. Menopause is seen as this kind of like this midlife thing, that we sometimes associate more with men in our culture, as being kind of a midlife crisis for women. Y'all, menopause does not have to be hard. So just let me say that in our culture in the US, we go through menopause earlier. We also have more symptoms statistically earlier than other countries. And part of that, I think, is really our lifestyle. It's our diet, it's the toxins we're exposed to, it's the medications that we take. It's our approach to, we kind of resist menopause, right? Kind of like I'm resisting 40. I'm also already pre-resisting menopause. So we see it as something that we're supposed to kind of fix or avoid, but it's just a normal part of life. And so I think mindset is everything. I know mindset is not going to help hot flashes and mood swings, but I think it does help when we think about reframing our experience. So we tend to go through menopause on average around 51, but the range is 45 to 55. It's usually more like in your 60s around the rest of the world. And again, I think it's all to do with hormones. We have so many things that are endocrine disruptors and estrogen mimickers that kind of, I think, force us into menopause a little earlier. I think it also makes our symptoms worse. So doing things like looking at the clean living lifestyle, we have two videos on that. If you can clean up your lifestyle, get rid of those fragrances, get rid of all of like the things that are going to stay on your skin, like toxic clothing, shampoo, makeup, things like that. Those things can really, really help make a difference. Vitamins and supplements, I think those are very individual. I used to do a lot of supplementation. I had an entire laundry room full of supplements, not laundry supplies. I don't take that many now because I don't need them as much, but I always prefer to try to get my vitamins in food or in the natural format first and then supplement. And to know what you need to supplement, you need to go and get blood work and ask them to draw your lab so that you can see, and then you need to be monitored for those. So that's my recommendation. There are a lot of great vitamin companies out there. I have some personal favorites. I don't have any affiliation with them, but I just feel good about using products from certain companies like Young Living, like Pure Encapsulations, Dr. Ben Lynch's vitamin company. There are a lot of great ones out there, but just, ask your primary care provider who they like to use. Try to avoid getting them at the grocery store or like a big box store or Amazon or something like that. I believe in getting them from a provider or from a trusted source. So these are some things that you can see with hormonal changes for women. And supplementation can help. Things like turmeric or turmeric, depending on how you like to pronounce that, has been shown to really help with menopausal changes. You also want to look at metabolic syndrome because sometimes when our hormones change for this, stage of life, it's really highlighting things that are already kind of going off the track. like having metabolic syndrome, which is, being overweight, not being able to process sugar well, those kinds of things. So do a more thorough check there. We also have a couple of doctors in town who have hormonal, kind of certifications and backgrounds and how to help manage that. So there's a couple of female doctors that also would be a great resource. For men, we also have to think about them. Men actually start to have a decline in their testosterone around age 40, and it drops off pretty steadily. And so, thinking about sexual health, if our hormonal balance is off with testosterone or estrogen, or for women, progesterone, then that's going to affect your libido. And it's going to affect even like the physical functional aspect of sex, not just your kind of wanting of it, your desire. So you can have decreased libido, hair loss, fatigue, I think is really important to note, mood changes, loss of muscle mass, increased body fat, especially around the abdomen, decreased bone mass. You can have memory issues. Y'all, that's a really important one. Lack of motivation or depression. Your blood sugar can go up. If you have a man in their 40s and above and they have anemia and they're not actively bleeding, you definitely want to check their testosterone levels. And then you can have issues with erectile dysfunction and then low volume or low count in the semen. So those are all some things that you don't think about with testosterone. You want someone to have healthy testosterone levels, and those need to get checked. And there's lots of things that you can do to increase those levels if they are declining, because you need a steady level for your testosterone. And notice that this happens around age 40, and then you think about women age 45, 50. So what looks like a midlife crisis actually may be a hormonal crisis, and so we can do some things to help with that. So weight loss over 40, why is it so hard? Everything starts to change. Your cells start to slowly stop replicating as much as they did in your 30s. It actually starts around age 34 or 35. You just start to notice it in your 40s. You have decreased digestion, decreased metabolism, decrease of your growth rate of the cells, and then lifestyle changes all kind of contribute to this weight loss resistance. So, what do you do about it? So, with weight loss, I think it's really important to approach it as looking at what all factors weigh in. So, I've got the chart here for you. Again, it's just a metric to look off and kind of get a starting point in terms of your calories and your activity. But if calories in, calories out, move your body worked, if that was the formula that everybody would respond to, then we would all be a healthy weight. And there's so much more than that in terms of lifestyle and hormones and things like that. So if you are doing all the right things, quote unquote, and you're not losing weight, it's probably time to talk to a nutritionist or someone who specializes in weight loss management. A health coach can help walk alongside you for sure. But I say you've got to sleep. You've got to make sure your blood work numbers look good. So your vitamins, your minerals, your electrolytes, your hormones, that combined with sleep, you start adding in your water, drinking about half of your body weight in ounces of water a day, and doing these wellness basics here, striving for a healthy plate where you're eating a lot of fruits and vegetables, you're eating a variety of colors, so you're getting all those nutrients and antioxidants that only certain colors of food have. You're moving your body actively and you're giving yourself, that mindfulness meditation breaks, letting your brain rest, right? I call them brain breaks. You're doing those wellness basics. That's where you really have to start. And then you can build these other good habits. Overcoming, other changes and things like adjusting for your eating needs. I really personally like intermittent fasting. It is not the answer for everyone, but keeping your blood sugar steady is also really important. When you have a lot of fluctuations in your blood sugar, it actually can cause anxiety. People say it mimics anxiety. It can actually cause anxiety because it's your body trying to get your attention to say, hey, Abby, feed me and feed me better than you've been feeding me. I actually did a little experiment with a continuous glucose monitor this semester just to see if I could tell when my blood sugar was peaking and valleying and kind of spiking. And it was a really, really interesting experiment that I did to see what foods that I needed to be able to kind of avoid or how I needed to stack my meals. And so not everyone can do that, but I think it's important to understand that your blood sugar fluctuations are really going to make a difference in how you feel physically and mentally. Knowing your biological rhythms are important. So, you've got to get in bed before midnight. Our best restorative sleep happens between 10 p.m. and midnight, which is sad for me because I'm a night owl, but that's just how our bodies work. Getting up with the sun and going to bed with the sun is how we like to do things, even if we don't personally love that. Just eating 100 calories more a day. So think about those 100-calorie snack packs. Just eating that much more of food a day can actually cause a significant weight gain. Y'all, if it comes in a package, try to think about whether that's a healthy option. You really want things that are plants and not packages. So shopping that perimeter, like I said, 100-calorie snack packs. I used to eat those all the time when I was starting to lose weight, and was so confused about why I wasn't healthy. There is nothing healthy about that, and so that's something to consider. Is that what we've been told is healthy may not actually be healthy, and then address those underlying medical issues. So, some other things about boosting your metabolism, there's things like hydration is key to that. You're not going to lose weight even if you're exercising and eating well if you're not hydrated. So, some other things that you can think about here, I just listed them as like a checklist for you to think about and incorporate. Some other things like people ask, what's the best time of day to work out? Whenever you can fit it in. Obviously, we don't want you working out right before bed, but sometimes do I do that? Absolutely. It just depends on your own body, but schedule your exercise like it's a meeting with yourself, and then don't have all or nothing thinking. If you need to get in 30 minutes a day and you can do 10 minutes here, 10 minutes there, 10 minutes later, that's perfectly fine. People tell you to work out first thing in the morning, and that's fine, but that does not work for everybody. Things like walking are really, those are important things to do. I think that is going to be the best thing to start with. That's what I started with. That's what most people recommend. It's low impact, it's free, it's easy. Check with your provider before you start exercise, but it's just something that's really attainable for most people. Remember to stretch. You're using all your muscles, so you want to make sure that you're stretching before and after you do a workout, even walking. Vary your routine so your body doesn't get used to it, and then pace yourself. I think we expect too much of our bodies sometimes, and my hand is raised. I've listed some more tips here. This is meant to be a checklist that you can print out, and you will have these slides. But just things that help, reframe what you need to be doing. This is a commitment to yourself and to your body. Think of a reason why you want to be healthy, why you want to feel better, and make it something that's really um, more important than I just want to wear my favorite blue jeans again comfortably. I mean, that is a fun reason, but maybe it's that you want to be around for kids and grandkids. Maybe it's that you want to be able to travel and feel well after you retire. Kind of attach it to a bigger why, and you'll be more likely to accomplish those goals. There's something called a wellness wheel I want to point out to you. The rest of these are pretty self-explanatory, but there's a wellness wheel. There's lots of different domains, 8 to 12, depending on which one you use, but it looks at your intellectual health, your social health, your emotional health, your spiritual health. So health is not just that you fit, in your favorite outfit and you like what you see on the scale. So I want y'all to think about wellness and health in that way. And then crowdsource some wellness strategies. So ask your friends what they're doing. Ask your coworkers what they're doing for health. I think that's great. That's how I learned about the Fit On app from Miranda. We were chatting at a health screening, and I learned that from her, and I love that app. So set goals. I left some blanks here for y'all to fill in. I think that's a great way to kind of get started on your journey. Some 40 after 40 habits. I've left this here for you. And I love number 40. Remember that the best is yet to come. And it truly is. No matter if you're 40 or you're 80, the best is always yet to come because it's a mindset. There's some special considerations, y'all. Things like caregiving and the sandwich generation. I think it's just important to name it when something's hard. And if you're caught in the middle of caregiving and raising a family, that's the sandwich generation of feeling a little bit like you're stuck. But there's a lot of good resources out there for caregivers. So think about that if you are in that situation. Pain management, and then we've got inflammation and gut health, eye health, sun exposure, knowing about your risk factors for melanoma, risks increase for shingles. So I want y'all to know about that. So even if you've had the shingles vaccine, even if you had chicken pox, it usually is going to be right there on the flanks. For ladies, you're right under your bra in the front or the back is where you likely see shingles. And then some things for mental health. If you're just not feeling like yourself, it may be time to reach out for some medical advice or some medical support. and then habit change. Just remember that long-term change comes from slow progress. And so just take baby steps to reach your goals, and start with those wellness basics that I mentioned. These are some recommended webinars that I think will give you some more information on a lot of the things we talked about today. And then we would love for you to follow us on our social media. And then I'm going to leave it here while we go to your questions. I added slides this time, and so I added a lot of information. Hopefully that wasn't too quick for y'all.